Yeah,
So
sure.
if you can briefly just describe the difference between a chiropractor, an osteopath, and a craniosacral therapist.
Wow, okay.
Do you want to?
Well, no, I'll try and address that. So, a chiropractor and osteopath. So chiropractic we spoke about already was in a sense discovered in Davenport, Iowa, in the United States, and osteopathy also came from the United States some years before chiropractic, and he was the discoverer of that. And the guy who put that all together was a Dr. Andrew Taylor Still, and he was in Kirksville, Missouri, and at that stage we didn't have all the knowledge of anatomy and physiology we have now. And his hypothesis was that if the vertebra goes out of place, it affects the circulation. So, which subsequently was proven to be, call it the wrong hypothesis, but basically using it as a model and saying we need to go in correct alignment with the vertebra and do that and that, they were getting the right results. And given the era in the 1800s, the second half of the 1800s, I think he was perfectly in order to say that, because there was no way of knowing anything different. Dr. Palmer came along and discovered and developed chiropractic, and he was looking at really what's happening with the nervous system, which was, as it turned out, to be more of a correct hypothesis. But osteopathy has evolved and changed over time, and they do what they call osteopathic manipulations, which is unique to them, and they also do a lot of other soft tissue work. So I haven't studied osteopathy, so I can't give you the complete story.
I will have an osteopath that I know come for an interview.
And they'll give you the
Yes,
full story. So
yes.
mine is just from the outside, the periphery. So don't take this as being the total truth on osteopathy. And so they have a little bit, I think they do a lot more. I have had osteopathic treatment, so that's my experience of it, but only from one osteopath, so I can't give you the whole story.
Right.
And so they seem to do a lot more stretching, a lot more mobilization of the joints, and then they do their osteopathic manipulations. And then as we
Manipulations.
Well,
Are you
that's
sure
the
they're
word
not
that,
also doing adjustments?
well, I say Dr. Taylor Still used that, but he called it osteopathic manipulation, distinct from generalized manipulation.
Right.
So that was, unique to their profession. From what I understand is, unfortunately, osteopathy was severely attacked by the medical profession in the United States and literally watered down, so it's no longer what it was. I believe the English trained osteopaths are still really true osteopaths, but the osteopathic, which they call in the United States a DO, Doctor of Osteopathy, they really have lost the essence of what their profession's about. And that was purposely done by the medical profession in the United States to try and destroy them as a competing profession. They also attacked chiropractic. They wanted to get rid of chiropractic. So that was a long protracted war.
I remember
which the
about that.
chiropractors fortunately were able to win. It took 17 years of court cases to ultimately in the Federal Supreme Court of Appeals to actually win that. But osteopathy, I think, suffered badly. So, but I say the European, the English trained osteopaths, I think, are still right where they should be doing the right thing. And they practice, we have a few of them here in South Africa, not many. And they do good work, because I have my patients go to see them as well and say, well, this helped me that. So anyway, then we go to craniosacral therapy, and that the osteopathic profession were really fundamental in developing what they call cranial manipulation, cranial osteopathic manipulation. They did a lot of work on that. And then in chiropractic, there was a chiropractor who developed a whole, what we call a cranial adjusting technique. The cranium up here isn't just a single bony chamber housing the brain. It's actually 22 bones, which all have their own joints and movement between them.
And they still move.
And they move all the time, which is critical to the circulation of the cerebral-spinal fluid and all kinds of things. And if they should get displaced, like through a bump or a bash on the head, which happens easily, I've had patients like fall off the mountain bikes or fall off the horses, crash on a skateboard, hit the head on the edge of the curb, and they come with this problem, that problem, can't open the eye, migraine headaches. And so it does happen that those joints get displaced and subluxated, as we use the word.
Would you recommend that sometimes some of your patients with those kinds of injuries also see a craniosacral therapist?
Yes. So let's say the osteopathic profession have a whole lot of those cranial osteopathic manipulations they do. In chiropractic, there was a whole field that grew out of sacral-occipital technique, which they call cranial adjusting, where they do pretty much the same type of work. And then out of that, I think it was Dr. John Upledge in the United States developed craniosacral therapy. I think it has its origins in the osteopathic and the chiropractic work that had preceded it. And for those people, it's actually very important. And we also get some of these babies that come in, their skulls have been very deformed through sort of birth trauma and that. So we have a lady that we work with in Somerset West. She's actually a veterinary surgeon by profession, originally trained in Belgium, but she can't practice veterinary medicine in South Africa. So she went and trained and she specialized in that. So and we do get nice changes in those patients and very good results. So it's quite different. And their big focus is really what's happening with the cranial bones. And the sacrum is part of it in that there's a covering around the brain, a membrane covering which extends around the spinal cord and goes all the way down and anchors actually, the bottom end of that anchors into the sacrum. So that's the connection. It seems that it's far away, but there's that interrelationship, and it affects this covering around the spinal cord and the brain and ultimately affects that function.